Hello, this is Dr. Mercola, and today I'd like to talk to you about a very common condition called acid reflux. So common, in fact, that it affects 1 out of 2 of you watching this video. Now, it has some other names. Some of the other terms are GERD, or gastroesophageal reflux disease, or peptic ulcer disease. And typically, it's felt to be caused by having too much acid. But I want to tell you, this is a medical mistake that is affecting hundreds of millions of people, because this is not a disease of too much acid. In fact, the condition is related more commonly to the acid coming out of the stomach where it's supposed to be, and there's a pyloric valve where it just tends to reflux over that valve, and that condition is called a hiatal hernia. When that acid comes out of where it's supposed to be, then it is causing those symptoms. Now, when I was in med school in the early 80s, in my residency training, there was an Australian physician, Dr. Barry Marshall, who did some pioneering work and actually found that this organism, at the time called Campylobacter, but now is called Helicobacter pylori, was found to be responsible, or at least a major factor, for producing many of these symptoms. And of course, now we have treatments that are designed to eradicate that organism. But there's over 16,000 articles that support that suppressing acid does not treat the problem. It only treats the symptoms. And let me tell you, the primary reason to understand this, or one of the explanations for it, is that when you suppress the amount of acid, you actually decrease your body's ability to kill this organism, because your body needs acid to kill this Helicobacter. So that would be one of the craziest things, because even though it relieves the symptoms, it does nothing to treat the cause and actually makes it worse. It perpetuates the problem. So one of the very first things you can do if you suffer with this condition and you've been made the unwise or choice of seeing a conventional physician for this, and they prescribe dangerous, let me repeat, dangerous medications like proton pump inhibitors, then let me provide you with a strategy to wean yourself off of those, because that's the last thing you want to do. And although proton pump inhibitors are very effective, they can relieve the pain, they are going to make the condition worse, and they actually develop a tolerance, a dependence on them, so that you can't ever get off of them. So the first thing you want to do is never stop proton pump inhibitors cold turkey. You've got to wean yourself off. So ideally, you would get a lower dose and gradually cut down the dose. And in the meantime, you can use another common drug that's used to control the symptoms, which is an H2 blocker like Tagamet or cimetidine or Zantac or ranitidine, which both are over the counter now. And you can go on those. You don't even need a prescription for them. You can buy those pills, and then you could substitute as you get down to the lowest dose of the proton pump inhibitor like Prevacid or Prilosec that you can tolerate. Then you would go on the H2 blocker, and then you gradually wean off of those over a few weeks. Again, you cannot go over the proton pump inhibitors right away, otherwise you have a severe rebound of the symptoms. That's one of the reasons why they're so popular, is because they work, but you can't stop them ever, because they make the problem actually worse than it was before you even started it. So once you're weaning yourself off of these, or actually you can do these therapies initially, you want to go on a lifestyle modification program that's going to eliminate this condition for you. And what are some of the things that you can do? Well, first of all, food allergies are a problem. So it can be a problem. So you want to eliminate things like caffeine, alcohol, and nicotine, or smoking, or chewing tobacco. So you want to eliminate those. No caffeine, no alcohol, no nicotine. You also, interestingly, as I said, it's not a problem with too much acid. It usually is a problem with too little acid. So one of the simplest things that you can do to encourage your body to make enough hydrochloric acid, and the acid in your stomach is hydrochloric acid, is to give yourself enough of the raw material. So one of the simple and basic things that many people neglect to do is to make sure that you're taking high quality sea salt or unprocessed salt. This is not true for a typical processed salt that you're going to use. You want to eliminate those for a lot of reasons that I've reviewed before, but you want to take a high quality salt. Now in my particular case, and I think the view of many experts, is the Himalayan salt is one of the best salts on the planet. And it not only will provide you with the chloride that your body needs to make that hydrochloric acid, but it will give you over 80 trace minerals that your body needs just to perform optimally biochemically. So making sure that you're taking a good source of high quality salt. You also want, if you can give yourself supplemental hydrochloric acid by taking betaine hydrochloride, and this is available in a health food store, and you don't need a prescription for it. And it is an acid, so that you would want to take as many as you can until you get that burning. And that is a strategy that you can use to help your body increase the acid, kill the Helicobacter, and normalize that symptom. Now, of course, you want to incorporate other lifestyle components. As I've mentioned many times in the past, vitamin D is essential. It's essential for this condition because there's probably an infectious component to it. And when you are on an optimal level of vitamin D in your bloodstream, you're going to optimize the production of 200 antimicrobial peptides, which will help to your body to eliminate and eradicate any infections that shouldn't be there. So making sure that your vitamin D is optimal, about 60 to 80 nanograms per milliliter, is tested by a high-quality test in the U.S. that's LabCorp, not Quest. And you can get that, increase your vitamin D levels by use of appropriate amounts of sun exposure or through the use of a safe tanning pad. And if those aren't available to you, then you want to take oral vitamin D. But you want to make sure that you're using the oral vitamin D, that you're making sure that you test your blood at a good lab like LabCorp. Of course, you want to exercise. Exercise is going to be another way to improve your body's immune system, and making sure that you're eating the right types of foods. If you're having large amounts of processed foods and sugars, then your body is not going to have the right type of bacterial growth in your stomach and your intestine. So cutting down on the processed foods, eliminating the sugars, making sure you're having lots of vegetables, high quality, organic, biodynamically, locally grown foods, and then also supplementing with additional good bacteria or fermented foods in your diet, because that's going to help change the types of bowel flora that are growing in your intestinal system, so that you will help to eliminate that Helicobacter. So these are the strategies. Nowadays, I find it's virtually never necessary to use antibiotics to kill a Helicobacter. Just by implementing the strategies I just discussed is enough to eliminate the condition in most of the people that we see. And that is a large number of people who suffer this. As I said, it's 1 out of 2 people. So it's a very, very common problem. And I'm hoping that these strategies will give you the tips and processes you'll need to help you and your family take control of your health in this important area.